This video is about mouth sores, nose sores, and anal sores from chemo and how to prevent them. You'll see on my YouTube site, and also I have a website, my daughter Kayla is being treated for acute lymphoblastic leukemia, and she's been in treatment for 13 months now, since January 4th, 2008. The first week in the hospital, Kayla got mouth sores, and they didn't look bad. She had teeny tiny red dots in her mouth on both sides. But evidently they were quite painful, and because of that, she would not eat or drink. The doctors gave her, it's lidocaine, and which is a numbing medication, antifungal in this kind of mouthwash. She hated the taste, and she said it killed the pain for 5 minutes, and then the pain would be back. Because of her not eating for 4 days and being in pain, I started doing research, and I found a book. Well, I went through several books. The fourth cancer book that I read had a sentence in it that said, L-glutamine may help mouth sores. Then I went and looked into L-glutamine, and all it is an amino acid. Amino acids are what make up protein. For instance, a piece of red meat has 22 amino acids, which make a complete protein. So I found out that the cells that line your digestive tract from your mouth to your anus are composed of, or lined with, fast-growing cells. Well, chemotherapy targets fast-growing cells because I think most cancers are fast-growing cells. Your hair is fast-growing too. That's why people lose their hair with some chemotherapies. So then I went and asked the doctors, what about L-glutamine? And they said, yeah, it's good. And I wanted to kill, because here my daughter was suffering week after week with mouth sores, and they had an answer and they didn't tell me about it. And that's a whole other subject for another web page or a video, because it has to do with legal liabilities. Okay, so I bought L-glutamine at the health food store. This is a product from Carlton Labs, and this bottle costs $12. It's a white powder. This one comes with a scooper, other ones don't. I think it's approximately half a teaspoon is the dose. You put it in water, and it dissolves very easily and has almost no taste. So you can see in this water, it clouds up, and then I'm just going to let it sit, and you'll see that the powder starts to go away. Kayla gets this every day. This is another L-glutamine from Annaball Naturals. They are on the internet, and when I get my shopping cart set up, I will be selling this product. This is also $12, and the only difference between the two is this one has B6, and B6 is a vitamin that's very good for your digestion. So once I started Kayla on that, the mouth sores stopped. In the following 9 months of chemotherapy, and it was high-dose chemotherapy, she only got mouth sores if we accidentally skipped taking the L-glutamine, like if we went to the hospital and she had to stay and I forgot to bring it. So I know this stuff works, and it works very well. So there you go with that. The next thing is for nose sores. Nose sores can be very painful, and if you have any kind of wound that can bleed and be open, this is very dangerous for immune-compromised patients. There's a product called AYR Saline Gel. So I'm going to hold it up for the camera. This is the gel. It's a small tube. It costs about $3, and it doesn't cause pain. But what you want to do is use this gel and put it in the nose to keep the sore from drying out and opening and allowing bacteria to get into the body, which is dangerous for immune-compromised patients. Very good investment. The next one for mouth sores. If you get a mouth sore, believe it or not, pickles work. I couldn't believe it. I had a patient in the bone marrow unit tell me this. So these are organic baby dill pickles, and I promise you they help get rid of the pain. And I don't know, $3 investment. Okay, so anal sores. there is a website, drwheatgrass.com, and he's a doctor out of Australia that developed wheatgrass extracts that really work. And how I found him is I found a medical study with women with breast cancer and wheatgrass, and then I started searching and I found this product. This is Dr. Wheatgrass Antioxidant Skin Recovery Cream. Here's a close-up of it. This tube costs $30, and trust me, it's a very small amount that you use, and it takes the pain out of an anal sore almost immediately. So this is a very good investment. You can purchase it at drwheatgrass.com, grassfactor.com, and eventually, when I have the money, I will have it on my website for sale as well. Okay, Biotene. This is a special mouthwash and toothpaste, I just don't have the tube with me, that has enzymes in it and is alcohol free, and it does not hurt your mouth at all. Kayla uses this every day, and it's particularly good when you have mouth sores because it gets harder to clean your mouth with anything that burns. And this Biotene does not burn at all. It actually was developed for dental patients, like if they have mouth surgery or things like that. So we use this all the time. Okay, acidophilus. That is the stuff that's in yogurt. Like when you open up a plain yogurt, you usually see a little film of liquid. That is acidophilus, and what it is it's a good bacteria for the intestines. Acidophilus is very important to aid the digestion when you're on chemotherapy. Here's some sample products. Like this is Gerodophilus. I found it at the health food store, and it's a powder, and it tastes good. This is another brand at the health food store, Primadophilus. This is capsules. Personally, we've switched to this product. This is called Orme Probiotic. It is sold through sacredhealth.net. The reason why I bought it is because this big bottle cost $45, and it has over 300 servings. So it's going to last you a very long time, and the dose is half a teaspoon. We put it in a protein shake or water or whatever. I think that's it. The key thing is to keep your mouth clean, take preventative actions. The minute your nose starts feeling painful or sore, same with your anus, do these actions and it will prevent infection and take the pain away. These were hard learned lessons that we learned, and they made a huge difference in Kayla's treatment and how she felt. Good luck to you. Thanks.